Hello friends, today we'll discuss about the treatment or management of migraine. So first a few words about migraine. So migraine is one of the commonest causes of headaches, and it affects almost 50 to 20% of women and about say 5 to 10% of men. This commonly affects younger people, so from the age of 15 to 45 it is more common, and the common symptoms can be headache on either one side of the head or both sides, along with nausea or vomiting sensation. And the headache typically gets worse with exposure to bright lights, sunlight, or noise. And people can have variable frequency. Some can have only occasional headaches like once in a month or once in 2 3 months, and in the most severe cases it can be daily headaches also. So how do we manage? So if you look at the management, basically we can classify into non-drug treatment and the drug treatments. So first, of course, we have to try non-drug treatment. In that, the important things are ensuring adequate sleep at night of 7 to 9 hours, and then having food on time, because fasting or delayed meals can trigger migraine attacks. Then reducing or managing the stress levels, and also exposure to bright light or sunlight, because that can trigger migraines. Some people have other triggers like noise or sound, so avoiding exposure to them also can help. Certain smells, strong smells like perfumes or certain foodstuffs. Many people have sensitivity to cheese, Chinese food, too much of coffee. So you can try to study what triggers your migraines, and if you can avoid them, so that the number of headaches can be less. Now, by rough estimates, about say half the people can manage their headaches with lifestyle measures like what we just discussed, but which also means that other 50% of people will require medical help or say drug treatment. So when is drug treatment needed? So one is the headache frequency. So those who have frequent headaches, say roughly once in a week or more than 3 days in a month, so 4 or more headache days in a month, they qualify for preventive drug therapy. So we have various types of medications like propranolol, flunarizine, amitriptyline, divalproex, topiramate. So we have various drugs depending on your clinical profile, your gender, age, body weight, any comorbid conditions like lack of sleep, any depression, anxiety. So your doctor will choose what is the best medicine for you. And then initially single drug is given. In some people we need to combine 2 or more drugs also, that is called polytherapy. And the purpose of these medication is to reduce the number of headache days and also severity of the headaches. And if in between headaches come, then we have to use rescue medications or the acute pain treatments. In that, common things like paracetamol or even sometimes specific drugs like triptans, like sumatriptan, rizatriptan. Many of them are specific drugs. They are effective. Now, regarding this acute pain relief measures, what is important is to keep a tab on the number of tablets that you consume. So typically if you exceed more than 10 tablets in a month, then there is a higher risk of something called analgesic overuse headache. So too much of painkillers also will become pain givers, so they will increase the number of headaches. So we have to ensure that the number of this acute pain relief treatments, they don't exceed more than say 3 or 4 in a week, and definitely keep it below 10 to 12 tablets in a month, because preventive medications are required if the headaches are frequent. Now what we often find is that with all these things, that is non-drug measures and even the preventive drugs, almost 30 to 35% of people do not respond. So do we have something for them? Yes, we have a few options for them also. So about say 5 to 6 years back, we had Botox injections which were given in the scalp injections, and that needs to be repeated every 3 months. And then after that we had this monthly injections by the name of Erunumab, which is available in India also. So that is given once in a month, and then it is continued for several months, and that works very well in people who have not responded to oral medications. And then we have a neuromodulation, what is called as electrical stimulation, and the device which can be worn on the arm, and that is known by the name of Nerivio, available in India also. And it works for acute migraines, that is acute headache relief also, as well as for prevention purposes. So I would like to highlight that these information what I have given, they are general in nature. Don't treated like a personal consultations. So if you have any headaches or migraines, first consult your doctor, get evaluated properly, because migraine, even though it's based on the symptoms, but in some cases we may have to do other investigations to rule out other causes of headache. So don't self-medicate, consult your doctor and then start the medical treatment. So definitely with all these options, a person with migraine need not suffer, and they can live a comfortable pain-free life.